Are your softball throwing mechanics causing arm pain? Have you ever wondered if your throwing mechanics in softball might be causing you discomfort? It is a common concern among players, and understanding the mechanics can help. Improper throwing techniques can indeed lead to arm pain by putting too much stress on your shoulder and elbow. When you throw a softball, your body goes through a series of complex movements. If these movements are not executed correctly, they can overload your muscles, tendons, and joints. One key area to focus on is arm positioning. If your elbow is raised too high early in the throw, it can increase stress on your arm. This often happens due to poor hand positioning or timing during the throw. Another critical phase to consider is the late cocking phase. This is when your arm is pulled back behind your body. During this phase, excessive external rotation can put a lot of stress on the ligaments in the front of your shoulder. Over time, this can lead to instability. The follow-through phase is also important. Here, the rotator cuff and ligaments at the back of your shoulder absorb forces to slow down your arm. If your mechanics are off or your muscles are weak, this can lead to injuries. Additionally, if you notice a loss of range of motion or strength in your shoulder or elbow, it can increase your risk of injury. Weak rotator cuff muscles and those around your shoulder blade can make it harder for your arm to handle the forces of throwing. Shoulder instability can also be a factor. If your shoulder stabilizers are weak, your shoulder joint may not be stable during throwing. This can lead to pain and potential injuries. It is important to note that pain is often not caused by the arm slot itself, like sidearm throwing, but by the mechanics leading to that slot. So, what can you do to reduce arm pain related to throwing mechanics? First, consider working with a qualified coach or professional. They can analyze your throwing motion and help identify any flaws that may be increasing stress on your arm. Strengthening your shoulder and arm muscles is also essential. Focus on exercises that target the rotator cuff and scapular stabilizers. This will help improve joint stability and lower your risk of injury. Maintaining your range of motion is another important step. Regular stretching and mobility exercises can help keep your shoulder and elbow flexible, which is necessary for safe throwing. Make sure to follow a proper throwing progression. Avoid jumping into high-intensity throwing or games without gradually building up your arm's conditioning. Consistency in your throwing routine is key. If you experience persistent pain, it is crucial to seek medical evaluation. A healthcare professional can rule out serious injuries like tendinitis or ligament damage. In summary, improper arm positioning, poor timing, and insufficient strength or mobility can lead to arm pain in softball players. By addressing these factors through training, conditioning, and professional guidance, you can work towards preventing and managing arm pain while developing effective throwing skills.